There's a financial threat sitting inside almost every retirement plan in 2026 that most people either don't know about or choose not to think about. And it is not a market crash, it is not inflation, and it is not running out of savings too fast. It is something far more personal and far more certain than any of those things. And it is quietly the number one reason retirement plans that looked solid on paper fall apart in real life. More than 80% of retirees have no specific plan for how they will handle rising medical costs as they age. Not a rough estimate, not a vague intention to figure it out later, no plan at all. And in 2026, with Medicare premiums rising, out of pocket caps increasing, and prescription drug costs climbing year over year, that gap between what retirees expect healthcare to cost and what it actually costs them is becoming one of the most financially devastating surprises a person can face in the final decades of their life. Let's start with the number that almost nobody talks about when they sit down with a financial advisor to plan their retirement. A couple retiring together at age 65 in the United States can expect to spend, on average, between $300,000 and $350,000 on healthcare costs over the course of their retirement. And that figure does not include long-term care. It does not include nursing home stays or in-home care assistance. It is purely the cost of routine medical care, prescription drugs, and insurance premiums above and beyond whatever government coverage they receive. That is roughly the equivalent of buying a house with cash, except it happens slowly over 20 or 25 years in a way that most people never fully see coming until they are already deep inside it. And here is what makes this number so dangerous, specifically for someone who retired believing they had enough. Healthcare inflation does not move at the same rate as general inflation. Over the last decade, healthcare costs have risen at 5 to 7% annually, which is nearly double the rate of general inflation in most years. What that means in your retirement is that a medical expense you pay $1,000 for today will cost roughly $2,000 in about 14 years if that trend continues. Your income from savings, your pension, your government benefits, none of those grow at 5 to 7% a year. So the gap between what you receive and what healthcare takes from you gets wider every single year you are in retirement, not smaller. If this is making you think differently about your own retirement plan, subscribe to this channel right now. Every week, I post content built specifically for people in or near retirement. Real numbers, real strategies, and honest conversations about the financial decisions that matter most in this stage of life. This is not a channel for beginners learning about money for the first time. This is built for you. Subscribe now before you keep watching. Now let's talk about Medicare specifically, because a lot of people enter retirement assuming that Medicare essentially covers their medical costs, and the reality is significantly more complicated and significantly more expensive than that assumption suggests. Medicare premiums have been rising consistently, and in 2026, that trend is continuing, with higher out-of-pocket caps and more expensive prescription drug coverage adding real costs to what retirees pay every month just for their baseline insurance. Medicare Part B, which covers doctor visits and outpatient care, requires a monthly premium that has increased almost every year for the last decade. Medicare Part D, which covers prescriptions, adds another monthly cost that varies based on your plan and your medications. And Medicare does not cover dental care, vision care, or hearing aids at any meaningful level. Three categories of healthcare that become increasingly important and increasingly expensive as people age past 65. The average retired couple pays over $700 a month in Medicare premiums alone before they have spent a single dollar on actual medical care. That is over $8,000 a year coming out of retirement savings just to maintain health insurance coverage, and that number grows almost every single year. If your retirement plan assumed healthcare would cost you something close to what you pay now while you are still working and covered by an employer plan, your plan is almost certainly underfunded, because the shift from employer coverage to Medicare typically represents a significant increase in out-of-pocket costs that most people do not fully anticipate. There is also a piece of this that goes beyond insurance premiums and routine care, and it is the one that has the potential to be truly catastrophic financially for people who do not plan for it specifically. Long-term care costs, meaning the cost of an assisted living facility, a memory care unit, or a professional in-home caregiver, are not covered by Medicare in any meaningful way and are not covered by most standard health insurance plans. The average cost of a private room in a nursing home in the United States is currently over $100,000 per year. Assisted living facilities average between $50,000 and $60,000 annually, and the statistical likelihood that someone over 65 will need some form of long term care at some point in their life is over 70%, meaning more than 2 in 3 people reading this right now will face this expense at some point, and most of them have no financial plan specifically for it. Here is the practical piece, broken into 3 specific things you can do regardless of where you are in retirement right now. The first is to calculate your actual projected healthcare costs with honest numbers, not the number you hope for. Take your current annual healthcare spending, add a 5% increase every year for the length of your expected retirement, and add a healthcare reserve of at least $150,000 to $200,000 specifically designated for potential long-term care costs. That number needs to live somewhere separate from your regular retirement income so that it is there when you need it and not accidentally spent on other things in the meantime. The second is to look honestly at long term care insurance if you are between 55 and 65, because this is the window where it is still reasonably affordable and where you are most likely to qualify based on health. Long term care insurance is not the right answer for everyone. The premiums are significant and the products are complex. But for people in this age range who have assets worth protecting and no other plan for long term care costs, it is a conversation worth having with a fee only financial advisor who does not earn a commission on what they recommend. The third is to understand the Medicaid planning piece if you are already past the point where insurance is practical, because Medicaid does cover long term care once your assets fall below certain thresholds, and there are legal strategies for structuring assets in a way that makes someone eligible for Medicaid coverage without simply spending everything they have saved first. This is a specialized area of financial and legal planning, but it exists precisely because this problem is common enough that an entire category of advisors has developed around solving it. The people who navigate healthcare costs in retirement without financial devastation are not the people who were lucky enough to stay healthy. Some of them stayed healthy and others did not. The difference is almost always that they treated healthcare as a specific, concrete, growing expense in their retirement plan, rather than a vague category they would deal with as it came up. The cost of ignoring this is not theoretical. It is the retirement savings you spent decades building, disappearing faster than you ever expected, into expenses you never fully planned for. You now have the framework to think about this differently. The next step is to run your own numbers honestly, and honestly assess whether your current plan accounts for what healthcare in retirement actually costs in 2026, not what it cost 10 years ago or what you hope it will cost in the future. Drop a comment below telling me what your biggest concern is about healthcare costs in retirement. I read every single one, and your answers directly shape what I cover next on this channel. And if you are not subscribed yet, do it right now. This channel is built entirely for people in or near retirement who want honest, specific financial guidance, not generic advice for someone 30 years younger. New videos every single week.